Okay. So we're hearing about using social media involving patients and public from different perspectives, aren't we? So we're going to hear now from Kyle Grieve, who's a communications officer, social media officer at NELFT. And what he's been doing is some fantastic work with using social media internally.
Thanks, Caroline. Just start off, it's been fantastic to be here today. We've heard so many different stories and so many social media from so many different perspectives. So it's been fantastic. And I think some of my stuff might cross over with what we've heard earlier, but hopefully I can provide a different perspective to it. So just to say, so my presentation is going to cover three main areas. Kind of first of all, talking about my own personal journey with social media and how I integrated that into what I do at work. Then talking about how our staff are using social media and how we're empowering them to do that. And then also just about the staff engagement event that we've ran now for the last 2 years, which is NELFT SOMI Week. Yep. As I said, if there's any questions on these that I can't answer during the presentation, I'll be talking about this more during my tabletop session with Ben Greenwood later on. So, first of all, so everyone saw my title, Empowering Staff to Use Social Media. So, did anyone know anything wrong with that or anything wrong with the words I used there? No. So I used the term staff instead of people, and one thing that I've been trying to get across when working with people in our trust is the fact that, you know, you should, if you're going to use social media, within your services or teams, think about it in terms of how would you use it yourself as a person, and, you know, what would you like to see if this showed up on your Facebook or Twitter feed. And by coming that across, that sort of helps to make people feel a little bit easier and also helps them to focus on what messages they want to share. So my social media journey, so not sure how clear the pictures are with this, but I'm very active on Facebook, Instagram, Twitter and LinkedIn. And part of this, I started off in this, really I got my first job in social media from talking about how I was using it personally, and since then I've always tried to sort of look back through my own personal, how I would use it personally, and try and reflect that and try and incorporate that into what I do for our corporate accounts. As you can see, I think someone else talked about how they were using social media at Pride, and that was actually my first Pride campaign. And one of the things I thought was really cool was that, you know, as a social media person, as going out to these events, you can kind of experience these and kind of, you know, it can sort of take whatever, it's kind of change whatever message you would like to share and give a different perspective. So just a personal one again, just of the, so this was at our, we were nominated for Team of the Year at the AHCM Healthcare Awards. So just sharing a bit about that. But also, I'm not sure how clear the text is there, but recently a member of staff within our communications team joined Twitter. And one thing that was really good about that was that they were, you know, they did that just off the back of seeing what our staff were doing, but also just because they wanted to use it themselves. And I thought that was really, really sort of inspiring. I thought that was really useful to kind of feedback to how we're using social media within the trust. So some of our speakers, the whole thing around this is that some of our speakers, you know, like myself, we use social media personally, but we also incorporate sort of professional work into our own into our personal social media, which is something I try to encourage within the trust. Is that, you know, don't you look at separate accounts. Try and see a way, if possible, and if you prefer to see how you could incorporate both your professional life into your personal life. So, lessons learned in this. So, social media is subjective. So, one of the things I found was that, you know, what one person might like read on social media might not be everyone else's cup of tea, and it shouldn't put you off using it, but rather look at sort of like what you're sharing and try and get in with groups that might be talking about the same thing. You need to have passion for it, and anyone who does social media in their organisation will agree with this, that I think if you don't have passion for what you're doing, or you don't have passion for social media, then it'll be more difficult to actually convey that whenever you're operating corporate accounts or whenever you're trying to empower your own staff to use social media. One thing. So, yeah, just off the back of that, we all have personal lives, so don't be afraid to share that on social media, and don't be afraid to share that in line with your work, because it adds a bit of personality. It allows people to learn a bit about the person behind the accounts, and sometimes you'll find that more people will actually maybe engage with you as a result of that. So one of the main questions that we hear from our people in the Trust is that they're not sure about social media, and some of the reasons are privacy. People are saying, oh, we're not sure if we should post that up, or we're not sure if we're comfortable with people seeing us on social media. What to share, as I said, social media is subjective, and some people think, oh, what I want to say might not be interesting, or I don't think I should say that. But really what I'd say is that, as I said, find the groups that you're linked in with, and what you might want to say, you might find through social media. You might find it might be someone across the country or across the world who is actually looking for information about the same thing. Also, time. There was a question there was a mention in one of the presentations earlier, I think it was maybe Slido, about our staff given time to monitor these accounts, and their staff actually allowed designated time. What we would say is that that social media shouldn't be viewed as this sort of extra thing, this sort of task that you have to do. You should really want to do it, and you should look to incorporate it into how you're promoting your existing promotion of your events or of your key messages. So everybody's doing it. So I asked a question on Facebook, really round about, when do you update your Facebook or Twitter status? It was a little bit of, bit of fun, but also a behavioural thing around, learning about people's habits. So when do you update so I do it on the train, do it on the tube, do it with porridge, do it very rarely. I do it when I'm waiting for my annual to put shoes on. I do it covered with a tiger, which was quite interesting. I looked more into that, and it was around an actual event that this guy was doing. And then the bottom one here, I do it when I have something interesting to say. So it's kind of looking at people's habits and looking at how they're using it, and then some of these habits you can take with you whenever you're empowering your people within your organisation to use social media. So, just coming on to NELFT Social Media Week, which I don't know if many of you heard about it on Twitter, or you might have heard about it from other areas. We have organised this event for the last 2 years. I think in the first year we were trending for, I think it was the last day of the week between Exeter Fire and Clocks Go Back. So quite interesting. It was quite useful to kind of see, right, how would that work, and how does that maybe give us more confidence in running these events. So how it came about. So won't lie, it was kind of my own passion project, and it was quite useful to kind of do that and to see, how staff reacted to that. I was quite lucky that our Director of Communications, as well as a lot of our executive board team, are quite active on social media, more to Twitter, and they were able to kind of see the value of that, and they were willing to listen to me and hear me out. So increase in demand from staff to set up the service accounts. So before we ran this event in 2016, we had around I think we only had around 2 service accounts that were up and running, and you will hear from the person behind those later. But since then, between this period of 11 months between the first event and the second event, we had around 20 to 25 services come forward to asking to set up these accounts. So promotion of brand, our work, and kind of maybe how we're using social media and providing other NHS staff and other sort of like public sector people to look at maybe share advice and share tips on how they can use social media. So the aims, as I said, highlight the fantastic progress and uptake by staff, showcase examples of best practice in social media. I'll go on in the next couple of slides to talk about maybe how we engaged with other organisations across the country and how we incorporated them into our event. But also empowering them to use social media, using emerging social media trends such as live streaming, such as Twitter takeovers, such as Slido, for example, and seeing how they can use that and what would suit best for engaging with their patients and engaging members of the public. So activity during the week, just a little bit of a breakdown. So we were quite lucky in that because of the interest from the first week, we were able to engage with London Ambulance Service, General Medical Council, NHS England, and the team, Health London Partnership, who, if you haven't heard of them, they're the team behind NHS Go. So 2 social media drop-in sessions, which were one-to-one sessions and focused on, the key questions that people had and how we were able to support them, and Twitter takeovers, which I'll go on to in a little bit. So just a few photos from the event. So down at the bottom here, we've got Anna MacArthur, who's the head of media and campaigns for London Ambulance. We've got Tanita Cross from General Medical Council, and the one there, that is our Chief Executive, John Bryder, with one of our other speakers. So, NHS-style Twitter takeovers. So, just a quick question. How many people have heard or come across the @NHS Twitter account? Brilliant, yeah. So it has been quite popular, and I've met quite a few times with the team behind that, and it's really come off as as the main way for allowing patients, members of the public, but also NHS people to share their story on a platform in a way that they may not have been able to do before. So some rules I had around it. So no involvement from communications on the day. The last involvement I had with the team was the day before, where I gave them the Twitter password. I said, look, can you just change the profile picture, but also just change the bio. That's the last involvement. Keep it personal and professional, so bring in a little mix, show a little bit of personality within your tweets, and use this as an opportunity to shine a light on your service that you may not have necessarily been able to before. So just to go through, so this is one of the days. So as I said, we are bringing in the corporate, which was, they shared this book around online data privacy, but also just sharing a bit about their healthy lunch, what they were eating for lunch as well. This was from our children's services. This is from one of our inpatient rehab services who look at various different things, including physiotherapy. One of our nurse consultants for long-term conditions, and tissue viability nurse. And one thing we were really keen on is, whatever you find interesting, if it was a news article, or if it's a photo, or if it's you're going to a meeting, for example, and you're tweeting from that, it's your account, do with it what you like for the day. And we have seen so much progress and so much enthusiasm from that. So these are some of the events from the week and from the last social media week. So nearly 200 followers during that campaign, that 6-week campaign. And that was actually, that 6-week campaign incorporated the whole time that we were planning it. So the first event, we planned it in around 3 weeks, and this one we had a little bit more time to do. 147 retweets, 140 people in attendance, but what we did was we live streamed the events, again using emerging technology, and about 5 times the number of people who interacted or were attended in person interacted through Periscope, and we'll probably see the same results from the stream today. And since October 2016, as I said, we've had around 30 services on Facebook and Twitter, and these are just, again, the pictures might come out better whenever we share in the slides after this, but there's just some impressions. And I think in total we had around 62,000 impressions throughout the course of that week. So over the 7-day period, it's about maybe just under 10,000. So some of the feedback. This is some of the feedback we had on the week from NHS people, and it was interesting that while they're sharing that, their followers are able to see that. And our whole point this week wasn't around, look at us, look at something good that we're doing. We wanted this to be an opportunity to share, for everyone to share advice, for everyone to gain something from this. And I think someone mentioned the line earlier, which is brilliant. If we can get one person actually involved, and actually, this can make a difference, that one person, then I just think that's my job done. That's something that I feel prouder about, rather than the 700 people who are watching it via Periscope. So as I say, this was all around staff engagement. This was all around providing tips for these things, and I've included in some of the posters and some of the attachments that I sent to Caroline and the team, just some tips around the main questions and the main top tips for staff, such as be yourself, be patient with it, and just have fun. So how you can have your own social media week. So decide on the objectives, what you want to achieve. And sometimes with social media, you find that a lot of people, what you might feel that people will drive this week, you have to make sure that it aligns with trust objectives, and it's something that when presenting this to your board of directors or when presenting this to your management team, it's something that they will be quite focused on. And it means that if you can link it round to their objectives, they're more keen to take it on. So corporate objectives. For example, one of the events that we did in our first year was around recruitment, and we held an event completely on using LinkedIn for recruitment. And obviously, big thing within the NHS. Look at guest speakers, whether you want to look at internal or external. One of the good things that we found already while doing our second event is that because of the amount of staff that were using social media, and because of the amount of people that were actively engaging with us, we were able to use them as spokespeople, and we were able to use them as ambassadors for this week. So we were able to concentrate a lot more on them rather than people just listening to me for an hour. Support from staff, as I said. Book venues. One of the issues that, while that might sound quite common sense, one of the issues that we had was that we chose a venue for one of the events this week this year that wasn't the best in terms of technology, and we kind of had a few hurdles that we had to overcome with that. Create visual content guides to share. So quite a few of these I've shared with Caroline and the team that will be shared wider after this. And it's important to make sure that while the presentations are going on and while you've got people watching the events and actually attending the events, it's important to keep an ongoing theme going on social media. What I find was, because I I'm the main person in charge of our social media accounts. Sometimes, if I'm speaking at these events, there's no one maybe sort of monitoring this. So I wanted to make sure I used Hootsuite and TweetDeck a lot to sort of schedule stuff in that was going along, stuff related to the events and to the presentations that I was able to share, and that was able to keep that going and keep using the hashtag. So, finding your own social media champions. So, we talked quite a bit today about, maybe we're still not sure about staff, allowing staff onto social media, or allowing staff to sort of operate our sort of service accounts. And one of the things I would say about it is, sometimes you just need to trial it out, and I wouldn't be afraid of just trialing it and working with staff and seeing how it goes. If it doesn't work, you can close the accounts down. And I'll just mention a couple of these things. So look at existing social media users and look at people who are using social media personally. And one of the things I say is, if you're using it personally, it's not a huge leap between using it personally and using it professionally. All you need to think about is in terms of the content that you're sharing, in terms of the messages. Focus on key services. So, for example, with ourselves, we focus Facebook on, say, our children's services or our older adult services. Twitter, we'll focus on services that, want to get more messages out to CCGs, to local councils. And Instagram, we're currently looking, we have our own corporate Instagram account, we're looking at Instagram for our children's services. So it's key to concentrate on those key audiences, key channels, and see where you can go with them. Provide training sessions and how-to guides. So we've mentioned it before, but it's so important to provide that training and provide that ongoing regular updates with them. Someone was mentioning to me earlier about updates that we might get from NHS England, or updates that you might get from local councils on campaigns such as the flu campaigns, winter campaigns, and what I will just do is I'll collate them and share them out amongst our services and see, maybe see how they can incorporate it. It might not be relevant to them, it might be, but by sharing that and providing regular updates and regular guidance, it sort of makes them feel more confident. It sort of makes them feel more cooperative. And what it will do is it will mean that, word will spread, and you'll find that more staff will feel a lot more comfortable because of experiences that they've heard from their colleagues. And utilising campaigns. So advantages of staff using social media. So cost benefits around that. The benefits in the video in a little minute. What you'll hear is you will hear from one of our services who were saying about how they've scrapped using printout leaflets and how they've scrapped using those information booklets and made that all available on social media and the benefits that that's had. Engaging with your customer service users, what you might find, especially with children's services, is you might find that you've been concentrating on website or you've been concentrating on emails, but that might not be necessarily the best platform in order to engage with them. And so you might try out that. You might be wondering, I'm not getting enough engagement on that, or I'm not getting enough interaction through that. And just focus on the channel, by focusing on the channel that they are on, by getting the message directly to them, which social media can provide, you can find that you might get a lot more engagement, and you might find that a lot more people will interact. As an organisation, we have a lot of campaigns that we're told about, and I think it was last month there was about 5 or 6 different health campaigns all going on at the one time. And what you might find that the corporate account, you might not be able to cover all of those. By having staff having people on social media, and by allowing them to have their service accounts, they can promote that campaign and they can promote those messages a lot more effectively than perhaps we could. So, Dr. and staff, I don't know if this video going to work. Yep.
When I was asked to lead on the social media sites for our services, my first instinct was to panic, because my involvement with social media really was just posting a few pictures on Facebook. Our service has really, it's taken off, it's gone places, because we've been able to do a lot of networking, liaise with a lot of other agencies that we might not have come across in our routine day-to-day work. We've been noticed by the local press because of some of the things that we have been doing, and they got in touch and wanted to do articles. We were also able to get some savings within our service, because when I started feeling confident that our social media pages were going well, I spoke with the comms team again, and a lot of the information that we give to our parents, we were able to transfer it via links to our webpage, and also have those links available on our social media pages so parents could access it. So instead of ordering our leaflets or printing them off, we were able to just give that information electronically. I think doing that alone was able to save our service over £20,000.
I have to say, before joining NELFT, I wasn't a user, for example, of Twitter. Now I use Twitter on a regular basis. It keeps me in touch with the pulse of the organisation. It helps me to see and realise and understand better what's going on throughout the organisation and what's foremost in the minds of all of our employees and staff. Right.
We cover a really big area as an organisation, and we have thousands of staff. So how do you effectively communicate with them? It's really important for me to have a platform that I can use, that is effective, that I can get to lots of people without physical presence.
Social media, it isn't scary at all. It's actually a very, for me, I see it as a very positive forum for engaging with our parents and our children and young people, and they have really welcomed it as well. I mean, we have had feedback from our parents. We had parents, we would take pictures of some of the parents and children at some of our activities, and obviously we have to have consent to do that, and they would follow that up. They would ask us, when are the pictures going to appear on the pages, so they're quite interested at what we are doing on social media, and they're really happy to join in with us.
So that's just a little bit. As I said, Catherine was one of the first people within our organisation that we allowed them to have social media accounts for their children's services, and as you can see, the results from them. The other thing from that video is we had. I was quite lucky whenever I joined North East London Foundation Trust that our chief executive and a lot of our managers and then the trust chair were already on Twitter, or were quite keen to have that conversation, and that's made my role a lot easier in terms of some of the campaigns that I do, for example, SOMI Week, and also just in terms of how I can get involved in events. And I would say that for staff, if you are looking at social media, or you are looking at doing these campaigns with other colleagues, show them that you've got support. Show them that there are other people using social media, and that will help in sort of making them feel a little bit more confident. Just some feedback that we've got here. So one of the biggest selling points for commissioners, which I think is quite keen. And just to finish off, so the big question, obviously the title of my presentation was to empower staff, but the question shouldn't be, should we empower staff to use social media? It's kind of like how, through using the tips and using the learning that we've gained here today, how can we take that and how can we go out and have our services on social media and get more of our colleagues involved in this? So thank you for listening to me. I realise at the end of the day it's quite long, but if you have any questions, I can answer them now. As I said, in my tabletop session with Ben, we can answer more of them in more detail. Thank you. Which ones? Okay, I'll start with that top one. Has this had an impact on work-life balance and staff well-being? It's interesting because there's a question around sort of like work-life balance and kind of doing that. But I find that if staff or if people are already using it personally, we don't encourage our people who monitor our service accounts to use it after 5 p.m. In fact, we include it in our disclaimer. But if they're using it personally already, if they're passionate about it, you will find that they will just use it anyway. And we haven't actually heard that, but we haven't actually heard someone question that. But if they do, I can sort of just give them advice. No, not at all. It doesn't dilute. In fact, what it does is it means that people following those service accounts are looking for those specific messages, and people are aware that through our corporate account, we will stick it to corporate messages, and we will keep it to trust-wide things. And what we find interesting was that people didn't recognise NELFT, or North East London Foundation Trust, as a brand. People recognise us as the NHS or that service that they refer to. So while they might not follow us, they will recognise more of that service, and they'll be able to find those key messages on there. Let's see. Okay, benefits of using Instagram. Instagram, I find it is much more visual platform, and we find that especially for our younger services and young people, we find that they weren't engaging with us on Facebook, and they weren't really interacting with us. They were interacting with us a bit through Twitter, but if you'll hear, sort of like, it's interesting. I was at a young person's forum, and they were saying, "Oh no, we don't use Twitter at all. We don't use Facebook. We only use Instagram and Snapchat." So it's sort of, in terms of that, again, it goes back to my earlier message where I'll say about finding the right platform for your audience and finding the right one that you can properly convey your messages through. Do we have time for one more? Okay. Okay. I think the third one there is more of the statement. Can your staff use work computers? Yes, it was interesting that someone mentioned, I think it was a group before me from Welsh Ambulance, mentioned that it wasn't long ago that they had social media allowed on their work computers, and it was something that I was quite clear on when I joined the trust, especially for people who are now using their services, because you have to be able to, there might be a difference between people using it, they're just sitting on it, or people actually using it for work purposes, and people have to have that option. And one thing, because many of you may know that Facebook, Twitter, other social media don't necessarily work as well on Internet Explorer. So what I've said is I've worked with our IT team to make sure that if people are having these service accounts, to make sure that they have Google Chrome installed as well, so that there'll be no issues around, there'll be no technical issues, and that they're able to have the best experience through that. Yeah. As I say, I can answer more of these in our session.